Sciatica. So what exactly is sciatica? Sciatica is when one of the nerve roots of the sciatic nerve gets pinched in the lower back. Now the sciatic nerve, as we see here on this diagram, this here is the sciatic nerve, and these are the last 5 nerves that join to form the large sciatic nerve, which also passes under the piriformis muscle. This here will be the back, that's the front. So when you have a pinched nerve, what tends to happen is that the irritation of that nerve then tends to cause pain to the parts of the body that is being supplied. Now this sciatic nerve, as we see here, this is the above the thigh bone, the hip bone is in there, and then this is the leg here. So the sciatic nerve is going to supply the leg. So when one of the roots of the sciatic nerve gets pinched, then you get symptoms of tingling, pain, numbness, cracking down the back of the leg. Now, in terms of a nerve getting pinched, so this here would be a healthy back. So these bones right here, these are the bones that you feel when you press into someone's back. That's the front here. This here is a healthy disc, has a tough ring with a jelly in the center. That's here the spinal canal. This here is the spinal cord that is running through the spinal canal. And then these are the nerves that exit the lower back. And those nerves would be represented, for example, these 2 nerves right here. See that there? Those 2 nerves here would be these 2 nerves that you see here. Because you have more nerves here that they'll join to form the large sciatic nerve. So again, so this will be a healthy lower back, and the nerves would exit freely here to supply the lower limb. Now, when you have rupture or damage of one of the discs, or the disc gets weaker due to age, trauma in the past, so what happens is that is a weakness that would then cause the jelly to begin to push out, and now you get some mild bulging. Now, just because there's a bulge doesn't mean it's going to pinch your nerve. The disc has to bulge enough in which to pinch nerve for you to actually get symptoms. But if you look here on the model, this here has actually bulged enough pinch on this nerve here. So in this case here, with this person, they would actually begin to have the symptoms of sciatica, which would be the tingling and the numbness tracking on the leg. Depending on the degree of pinching or how severe it is, that would also determine on how far down these symptoms track, how severe these symptoms are. If it's very severe and it's really, what can happen here, you can actually get weakness in the leg. Your leg can actually lose muscle as well. So basically, just to let you know what sciatica is. Sciatica, it is a pinch nerve. Is really, and the nerve that gets pinched is one of the roots of the sciatic nerve, or one of the nerves that make up the large sciatic nerve. So to recap again, the sciatic nerve is this large nerve here that is comprised of all these 5 nerves joining together. Now, I'm going to come here and talk about the piriformis muscle. Now, there's a situation called piriformis syndrome. In piriformis syndrome, what happens is that the sciatic nerve actually gets pinched, but not in the back. Okay, the disc is not bulging and pinching one of the nerve roots. Rather, this piriformis muscle here goes into spasm, it gets tight, and then it irritates the sciatic nerve, and then you begin to get symptoms similar to that of sciatica. Okay, so in a person who has true sciatica, where there is a bulging disc and pinched nerve, if you do an MRI, you would see that disc and bulging and pinching on the nerve. In a case of a pure piriformis syndrome, when I say pure piriformis syndrome, this is where the sciatic nerve is irritated only at the level of the piriformis muscle. Everything else up here is healthy. So if that person did an MRI, you would see a healthy back. You would not see any severe disc bulging, but the person would still report symptoms of sciatica. Of course, there are certain tests, clinical exams, maneuvers that can be done within the doctor's office to help you listen whether it is sciatica or piriformis syndrome. Okay, so and also as well, just to note, in the case of osteoarthritis, where the disc begins to dry up, then you have the bones, the upper and lower bones coming closer together, and that can potentially create a pinch point at the exit here. So in osteoarthritis or severe osteoarthritis, you can also have sciatica, but in this case, it is the bones that are pinching on the root of the sciatic nerve. But also as well, in what can happen in the picture of osteoarthritis, you can also have associated bulging disc that is pinching on the nerve. Okay, so just keep that in mind. There is a textbook way to look at sciatica, but in real life, it may not just be one insult, but rather it could be a combination of insults that are leading to the person having the particular sciatic nerve or the sciatica symptoms. Okay, so let's hope that shed some light on what sciatica is. If you have any questions or you want treatment, you want to be seen by a doctor or a therapist, we are in Chincuna Gardens in Cunupia. You can call or WhatsApp 747-5297. You can also send pictures of your MRI reports, take pictures of your x-rays, send them on WhatsApp. We'll take a look at them. We'll give you a call and see what we can do.
You can tap the description below for all of our contact information.